Thank you, Mr. Speaker. Today there's been a lot of discussions about many aspects of House Bill 59 and Omnibus Human Services Code change, mostly to try to rein in some spending in a very responsible way. If you look at the IFO report on government expenditure growth over the next 5 years, DHS alone will attribute to $3.8 billion over the next 5 years. That's $2.1 million a day of new spending that we need to come up with in the General Assembly. $2.1 million a day. Last week we did some work on I think some pretty good Medicaid reform bills in this House that passed by wide breadth of votes. Today we have some other changes, some good changes that allow greater access to substance abuse, payments to providers for out-of-home placements, electronic asset verification, nursing home facility assessments, ambulatory service facility study, limitations on Act 534 employees, total population coordinated care, efficiency evaluation, work requirement, Institute of Mental Disease waiver, supplemental appropriation waiver requests, loophole premiums. Some robust policy changes that will change the dynamic of that cost curve, embed it down to within our revenue cost structure. A lot of discussion has been on, obviously, the kids in the loophole proposal. If you break down the actual demographics, out of the total percent of children in their income cohorts, it covers about 6% of the families. 6% make over $200,000. There's actually less than 2% that are affected. About the average cost per person, $17,626. If you make over $250,000, family of 4, maybe one child within this program, you're looking at a $50 copay or $600. Many of you pay more for your health insurance in this chamber than what we're asking responsibly. For the most part, it's followed under CHIP as well, which Pennsylvania residents are paying at 200% of the poverty level. It's fair and it's equitable moving forward, Mr. Speaker. Mr. Speaker, we're never going to change the dynamic. We're never going to reinvent government unless we can rein in costs of state government in a responsible way, where we're not kicking individuals off, our most vulnerable off important programs. That's the scope of these reforms within this bill. It's to protect the most vulnerable, ensure those that have the ability to pay can pay, and ensure that we institute responsible work requirements to ensure that those that are capable of working work. And we've seen it in other states. Growth of revenue to the general fund, growth of self-sufficiency, growth of individuals' work to be self-sustainable. Mr. Speaker, we've seen it in multiple states. Maine, for example, individuals prior to installing work requirements under the TANF program were making about $3.7 million a year. After work requirements, their income increased to over $8 million. That's improving people's lifestyle, improving people's quality, improving healthcare outcomes for individuals, Mr. Speaker. I think it's appropriate, I think it's responsible, and I think it's good government, Mr. Speaker, to ensure that we sustain our welfare programs. Currently, Mr. Speaker, Medicaid assistance is getting cut currently. Regardless of what the federal government may or may not do, federal reimbursements are dropping. This year alone, it was a $199 million cut from the federal government. That will be reduced each year for the next 4 years. It's a reality. The federal government will never, ever, ever, ever keep their promises. Look at our special education costs. They were supposed to pick up a majority of our special education costs. Here we are, almost self-funding our special education costs because they refuse to do the job. Mr. Speaker, we cannot count on the federal government. They will not come through on us. We need to make sure we provide the protections and the sustainability of these important programs from now into the future. We can't do that unless we do these changes, Mr. Speaker. Mr. Speaker, for the sanctity of the most vulnerable, for the sanctity of budget predictability, for the sanctity of making sure we do the right thing today, I hope you will join me in voting yes to House Bill 59 to make sure we protect the most vulnerable regardless of what happens at the federal level. Thank you, Mr. Speaker.